Namaskar. On the occasion of World Diabetes Day, actually I am going to discuss a very important topic because diabetes is the number one kidney killer in the world. Among all the causes of kidney diseases, diabetes is the number one. So every diabetic patient should know how to protect their kidneys from the diabetes doing damage to their kidney. So important thing is that if you are suffering from diabetes, then definitely the control of blood sugar is very important, because that is single most important factor which will damage the kidney, because it is seen that around 40% of diabetics will have kidney disease, and among this 40%, then again another significant people, maybe around 10 to 15% patient will develop end-stage kidney failure. So this is very important that you don't develop end-stage kidney failure requiring dialysis and transplantation. You have to keep your sugar in control. And how to control blood sugar? I think everybody knows it. By your proper diet control, regular exercise, and stick to your medicine what you are taking, or your physician advice to take it. And the next important thing is the control of blood pressure. Why? Because blood pressure is the second most common cause of kidney damage in the world. So if the combination of blood sugar, high blood sugar and blood pressure is there, then it is a fatal combination, and it will very rapidly damage your kidney, and you will end up at end-stage kidney failure. So once you develop high blood pressure, you control your blood pressure by your proper lifestyle changes like regular exercise, taking less salt, and your regular diet control, and that will keep your blood pressure in control, and that will preserve your kidney function. And exercise. So how exercise helps in the your management of diabetes and diabetes kidney disease? Because once you do proper exercise, then it will control your blood pressure, it will control your blood sugar. Again, these two together, once there is a control in your blood pressure and blood sugar, that will prevent the progression of your kidney disease. And how much exercise you have to do? It is recommended that minimum 30 minutes per day or 150 minutes in a week. Mild to moderate exercise is important for your health and well-being. The next important thing is protein diet, high protein diet. So why it is very important? The protein is a poison to kidney. If you take more protein, that will damage the kidney. So what is the normal requirement of protein for a normal person? It has been estimated that around 0.8 to 1 gram per kg body weight protein requirement for a normal person. Suppose if somebody is 60 kilo, then his protein requirement is around 60 gram. But if somebody is developing kidney disease, either due to diabetes, hypertension, or a combination of things, then the protein requirement is around half of that. That means the same person of 60 kilo will require 30 to 35 gram of protein. So here I want to say that please don't stop eating totally protein, because if you take less protein also dangerous for you, because once there is decrease in the protein in your blood, that will lead to lot of infection or other complication. So you have to reduce protein but not to stop protein. So here you have to remember that thing. And again, the next question is which protein is better, whether it is animal protein is better or is a vegetable protein is better. So it has been seen that it is the vegetable protein like dal and or other things, soybeans. These things are better than a animal protein. And keep taking your medicine like obedient student. As obedient student reads whatever it is they are told to do or do study, they do it. Similarly, you have to take your medicine as sincerely as possible, so that your blood pressure and blood sugar will control, and ultimately that will prevent the progression of kidney disease. And sleep at least 6 to 8 hours. Why? Because when we sleep, then there is a lot of hormonal balances occurs, the insulin goes down, so other hormones like growth hormones, cortisols, those things, they come to play, and there is a great hormonal balances occurs during the sleep, and that is very important for our health and well-being. And that is why unless if you will not sleep properly, then there will be too much rise of your stress hormones like your cortisols, your growth hormones or other hormones, and that will depress the insulin, and the blood sugar will rise. So ultimately, if you will not get a proper sleep, then your blood sugar will not control, and again this high blood sugar will damage not only kidney, the other organs of the body like eyes and heart, other many organs it will damage. So sleep at least 6 to 8 hours, and probably that is sufficient. It is nice to see this gentleman is smoking. It looks very smart, but it is not smart for your body. And this smoking is this smoking causes a lot of injury to your lungs, and also not only the lungs, also to your blood vessels which supply to the heart, kidney, brains, and your pancreas. So smoking also causes a lot of damage to our endocrine system. So that is why if you are smoking, then immediately stop it, so that your kidneys kidney functions will be reserved. The next important thing that you have to keep a healthy body weight. So what is a healthy body weight? Actually, it depends upon your age, your height, and your ethnicity. So from your doctor or from the internet, there is a lot of formulas available. You can calculate what is your ideal body weight, and suppose your ideal body weight is 60, then keep it near to that. And scientifically, that is seen that maybe 10% of your 10% more than your ideal body weight may be welcome, but not more than that. Suppose you are 60 kg, so around 65 to 66 kg can be acceptable, but not above that. Then why? Because once you put on more weight means there is a lot of fat is accumulated inside your cells in the pancreas. Then your insulin not work properly. Then there will be hyperglycemia. There will be sugar will be not controlled. There will be hypertension. And if you are obese or if you are suffering from obesity, then also you damage the kidney. So combination of diabetes, high blood pressure, and obesity will kill the kidney. And when it's stress, so nowadays there are a lot of stress, maybe due to environmental factor, maybe work, job, maybe whatever, maybe there are a lot of maybe family problems. There are a lot of stress nowadays, maybe working space, there will be stress. And once there is a stress, why the stress is dangerous to our body? Because once you are stressed, there is stress hormones like cortisols, thyroid hormones, corticotropins, there are a lot of growth hormones, a lot of other hormones which are secreted from the body, and that depresses the insulin, and there will be increase in the sugar. So how to tackle stress? I think it is different for different people. You can go for a meditation, you may go for a yoga exercise, or a simple exercise. You may do singing, dancing, or gardening, or whatever may be, or you can do some social work, or keep your friend circle alive, so that will reduce your stress, and ultimately that will help your reducing your blood sugar and keep your kidney healthy. And stop eating sugar spiking diet. So what is sugar spiking? Sugar spiking means suppose you are eating some food like your chapati or rice or something, then it goes to the stomach, and then it will digest it, and the blood sugar absorbs slowly, and the blood sugar rises slowly. But suppose you are taking sugar or glucose, then what happens? That sugar immediately absorbed in your stomach and intestine, and there is immediate rise of blood sugar, and this sudden rise blood sugar is dangerous to our body, because it causes a lot of chemical reaction inside our body, and that is harmful to us. So even if somebody's your HbA1c is normal, your blood sugar maybe fasting is normal, but this sugar spiking can also it can have similar effect like high blood sugar or diabetes. So try to avoid all sugar spiking diet, and the sugars are there invisibly many of our foods like your sweets, sugars, simple sugars, fast foods, cold drinks. So there are a lot of foods are there where these sugars are hidden, and that can cause sugar spike, and that sugar spike can cause to damage to our body, and ultimately it is kidney which is damaged more than any other organ. And avoid nephrotoxic drugs. So what is a nephrotoxic drug? The drugs which causes damage to kidney by its action. So number one is NSA, non-steroidal anti-inflammatory drugs, particularly the diclofenac, aceclofenac, naproxen, then your ibuprofen, brufen. There are so many NSAIDs are available. So please try to avoid these drugs, particularly if you are diabetic, if you are elderly, or you have other diseases like heart disease or liver disease or kidney disease, then try to avoid this. And the next common is the PPI, proton pump inhibitors. These are the drugs very frequently used for acid control. The drugs are your omeprazole, rabeprazole, pantoprazole, and people nowadays taking these drugs in tons. So it is now estimated that they are one of the cause of chronic kidney disease, and they can cause your kidney damage. And if you are having diabetes, then it like more you are prone to suffer from kidney disease. And immunoglycosides are the antibiotics. So these are the antibiotics which can cause directly kidney damage. And if you are having diabetic kidney disease and you take immunoglycosides, then there will be double whammy, and the kidney will damage very fast. So try to avoid any nephrotoxic drug, and take your dinner before 8. So you may be surprised why I am mentioning that. Nowadays everybody takes their dinner at 10 or maybe after that, and after finishing their job in their businesses or their office, they come late and they take their dinner or lunch very late. But this is a very devastating behavior, human behavior of the modern days, because this is a single factor is causing a lot of hormonal disturbance in our body. So if you take your food after 8 p.m., there will be poor digestion, and once there is a poor digestion, and you not get proper sleep. Also in the night, actually already I have mentioned in the night what happens, your the hormones are get streamlined, or that will be their balances occurs in the night. So once you take late night lunch, then there will be no digestion, proper digestion. Then there will be hormonal disturbance that will lead to your improper insulin and other hormone control, and you will be your blood sugar will be high, and that will ultimately again this high blood sugar will cause your kidney damage. And that is why take your dinner before 8. It should be light dinner, and take low glycemic index food like your whole cereal food, or maybe vegetables are better, and should be light dinner. Thanks for watching. Please subscribe our channel so that you will not miss our videos on health. Thank you.